Hello everybody, welcome to my YouTube channel. My name is Adudeng. I am a student of Maradi University. I am in my third year and I am doing a subject called orthopedics. And basically in today's subject we are going to be talking about the classification of fractures in orthopedics. This is Mediplex 2. Okay, so let's go into deep details about the classification of fractures in ortho. So in the classification of fractures, we have 5 classifications here. We have based on etiology. We have fractures that are based on relation with external environment. We have fractures that are based on the displacement. We have fractures based on patterns, and we have fractures that are based on the quantum of force causing fracture. So let's go into deep details of this classification. So the classification which is based on the etiology, we have the traumatic fracture, the pathological fracture, and the stress fracture. Simply, the traumatic fracture is a fracture sustained due to trauma. That is why we call it the traumatic fracture. You see, in this fracture, most fractures are seen in day-to-day practicals fall into category. Examples of fall, road accidents, flights. These are the main causes of these traumatic fractures. In the pathological fractures, basically the pathological fracture means fractures through a bone which has been made weak by some underlying disease. That's why we call it the pathological fracture. And talking about stress fracture, this is just simply a special type of fracture sustained due to chronic repetitive injury causing a break in a bone tubercle. Like a lot of stress, most weight-bearing activities. This is, I can say these are one of the examples of stress fracture. This stress fracture often presents as only pain and may not be visible on x-rays. We go to the second classification, which is based on the relationship with external environment. In this, we have specifically only 2, the open fracture and the closed fracture. In the open fracture, this means the fracture with a break in overlaying skin and soft tissue, which is leading to the fracture communicating with the external environment. In this type of fracture, there are 2 types of fracture. We have the internally open and the externally open. The internally open basically means the fracture which is within the body, and externally open, which is the fracture which is outside the body. Our second type of fracture is closed fracture. In closed fracture is basically not communicating with the external environment, like the overlaying skin and the soft tissue are often in contact with the body. The third type of classification is based on the displacement. And displaced fracture are easily to identify by the absence of significant displacements. And displacement fracture are fractures that may be displaced. The factors responsible for displacement are the fracture forcing, the muscle pulling the fracture fragment, and the gravity. As we can see here in the diagram, there are 3 types of fracture due to displacement here. We have the shift, we have the angulation, and we have the rotation. Here in the shift fracture, the bone goes sideways. That's why we call it the shift. In the angulation, the bone, like, it breaks between the both of them, and there is a space between it, which goes to the skin. And then the rotation, basically the bone that has been broken will rotate, and the one which will stick to the joint will stay. Now let's talk about the fracture based on the patterns. As you can see here in the diagram, we have the green stick, we have the transverse, we have the comminuted, we have the spiral, and we have the compound. And the green streak is just a simple fracture that just takes only half of the bone. In this green streak fracture, not much surgery can be done, maybe just little. In this transverse fracture, it's just a small transverse line that takes place. In the comminuted fracture, as you can see, the bone is totally damaged, and in this case we are going to have to put some metals so that the bone can grow to each other again. And in the spiral fracture, as we can see, it's one of rotation fracture. And the compound fracture is basically when the bone is totally broken and it comes out of the skin. So let's continue to fractures, classification of fracture, which is based on the quantum of the force causing more fracture. We have the low velocity injury and the high velocity injury. In the low velocity injury, these fractures are sustained as a result of mild trauma force, as in a fall. Lately, there are changes in the pattern of the fracture due to shift from lower velocity to high velocity injuries. And in the second one, we have high velocity injuries, which is obviously caused by the low velocity injuries. In these high velocity injuries, the fractures are sustained as a result that are from severe trauma force or traffic accidents. In this fracture, there are severe soft tissue injuries, like the compound fracture that we showed you before in the best of. Thank you once again for watching my video.